And thanks, Karen, for bringing us through some of the detail of emotional dysregulation, and particularly your opening comments about the ability to treat rather than punish. Very profound. So can I ask your colleague now, Fergal Black, who's Director of Care and Rehabilitation in the Irish Prison Service, also to share some further insights. Thank you, Fergal.
Good afternoon, everybody, and thank you for the invitation today to talk about addiction in prisons. As our Director General has said, the vast majority of prisoners return to their communities, and a key objective of criminal justice agencies is to make communities safer and ultimately have less victims. We believe that by improving the prison system, we can help prisoners change their lives, better protect prisoners and those who work in prison, help break the cycle of reoffending, and save the taxpayer money. A former UK Secretary of State for Justice put it well when quoted saying, "Our streets will not be safer, our children will not be properly protected, and our future will not be more secure unless we change the way we treat offenders, and offenders then change their lives for the better." There's a popular myth in some quarters that prison should be about breaking people down. My view, and the view of the Irish Prison Service, is that we endeavour to empower people and build them up. Throughout each prison sentence, steps should be taken to give people in custody the best possible opportunity to reintegrate themselves into society by imparting some life skills to put them back on the road to being a good citizen. We also need to get through to people in custody that we need them to understand that their actions hurt people and they trample on people's rights. There is a constituency that would argue that what we're doing is a soft approach. I would take an alternative view. We need to challenge offenders to take responsibility, to start owning some of their behaviour, and a harsh approach doesn't achieve this. The most effective intervention with someone in prison is the relationship they have with staff. And we're very fortunate in this jurisdiction that we have very good relations between prison staff and prisoners. This requires that people are treated with dignity and respect. This builds relationships. The relationship is an instrument to take an offender into a space where they begin to own some of their behaviours and take responsibilities. Prison provides a unique opportunity for someone to address their addiction if they're with us for long enough. Criminal justice agencies have a primary responsibility in relation to drug supply, and I know you heard about that this morning. However, the criminal justice agencies also make considerable contribution to the state's overall provision of drug treatment and rehabilitation services. Examples involve the department's funding of the Garda Youth Diversion Scheme, involvement in funding for the National Drug-Related Deaths Index, and our input into the National Drug Strategy, Reducing Harm, Supporting Recovery. The Irish Prison Service is finalising its own new strategy, Harmful Drugs Strategy 2023 to 2026, which seeks to reaffirm the work already underway across the estate and review and enhance other methods to tackle the problem of illicit drug use and demand. The strategy sets out ambitious goals under 3 pillars to address the issues of drugs in prison: inform and educate, detect and reduce, and support and treat. And I would say to you in this regard that prisons are a microcosm of society. What happens in society happens in prisons. The primary objective of the Irish Prison Service, through our healthcare service, is to ensure that the provision of healthcare to prisoners is at a standard consistent with what applies in the general community. So a prisoner should expect to receive the same level of care as if they had a medical card in the community. Overall, addiction programmes in our prisons seek to reduce the demand for drugs within the system through education, treatment and rehabilitation services for prisoners suffering from addiction. Particular initiatives include the provision of detoxification, methadone maintenance, education programmes, addiction counselling and drug therapy programmes. In relation to true care, which is a really important element, the Irish Prison Service, in consultation and collaboration with our HSE Addiction Service colleagues, make every effort to ensure that prisoners engaged in treatment programmes are linked to community addiction on their release. Last month, the Irish Prison Service, partnering with HSE Addiction Services and the Red Cross, launched a life-saving initiative to combat opioid overdoses among prisoners. The increased risk of death from overdose in the first weeks after release from prison is well documented and can be as much as 12 times higher compared to the general population. The Irish Prison Service commencement of the provision of an intranasal naloxone on release to people with a history of opioid use may prevent fatalities in the event of an overdose. This new collaborative approach is poised to raise awareness, save lives, and contribute to the successful reintegration of people struggling with addiction. Moreover, we in the prison service have reinvigorated and recommenced our treatment and recovery programme, which was previously known as the drug treatment programme in Mountjoy, which had been suspended during the pandemic. The objective of TARP is to support individuals in their recovery to live a fulfilling, substance-free life, to facilitate their successful reintegration back into society. It's a 9-week programme, has 9 places, and there are about 6 programmes facilitated annually. We're very fortunate we have a contract with Merchants Key Ireland to provide an essential addiction counselling service to prisoners under contract with ourselves. We are indebted to HSE Social Inclusion, who provided a financial contribution for the MQI service.
Just 1 minute, please, Fergal.
So I'll move on then quickly. I believe it's evident from what I'm saying that prisons are a very important component of the overall response to drug problems in Irish society. There's often a lack of recognition of other services, of the scale of activity within prisons. An illustration is that we have 650 patients with active methadone prescriptions in custody today. More worryingly is the fact that almost 50% of women incarcerated in DOCAS today are on methadone substitution therapy. Of the 11,600 people in receipt of methadone in the state, 1 in 6 of those will end up in custody in any given year. So this is a particular challenge for the Irish Prison Service. And I suppose what I would say is that we have recently commissioned with the Department of Health a health needs assessment, and we need to improve the level of services, the level of collaboration with our HSE colleagues, providing specialist services to prisons. We provide specialist mental health services from the Central Mental Hospital. Unfortunately, we don't have a comparable service within addiction.
Thank
so I'll leave you with that thought, and thanks everybody.
Thank you, Fergal.